Here to give us more details about the ongoing COVID-19 surge in the Philippines, we have with us health reform advocate Dr. Tony Leachon and infectious disease expert Dr. Rontgene Solante. They're joining us live via Zoom. Good evening, Dr. Solante and Dr. Leachon. Welcome once again to The Big Story.
Good evening,
Robbie.
Good evening. Hi, Jean.
Dr. Leachon, let's go straight to this BA.5 subvariant. It's the latest. It's also supposedly, we suspect, possibly the dominant variant right now. But being newest, being most dominant, is that necessarily cause for concern?
Well, it's actually a subvariant of concern right now. Not only BA.5, but the other subvariants like BA.4 and the latest 2.75. Because of the limitations of the PGC or the Philippine Genomic Center, and of course the lack of funds here, we cannot do all the surveillance tests. The other thing is that the report may be underreported, although Jeet can talk about it, because we're recording most on RT-PCR and not the rapid antigen tests. But on the ground, as we see patients, we see a lot of patients on telemedicine. And then slowly, the healthcare utilization rate is going up as well. The positivity rate is 18.4%. So what's driving the increase in the surge right now? I think it's the arrival of the subvariants, which maybe the cases are actually increasing, the waning immunity as well, the low percentage of our booster rate, peg around 15%. And of course, the inadvertent non-adherence of our countrymen to the wearing of masks and everything, because of economy as well as the calamity related to the earthquake and other things. So it's actually a confluence of a lot of things. And mainly it's the subvariants that is driving the surge right now.
Okay, but Dr. Solante, nabanggit ni Dr. Leachon in particular, one of those factors also waning immunity and still the slow uptake of Filipinos for their booster shots. But just isolating that factor, how big of a factor is that in the grand scheme of things?
It's really big, Robbie, because you have here a subvariant that evades antibodies from vaccines. Let's do the math. If 70% are already vaccinated with the primary vaccine, you're not protected. You'll still get the BA.5. Now, are you getting or will you be getting the severe infection? That's a question mark. If only 19 million are boosted, you can still get the BA.5. So, in totality, most of those infected now are already vaccinated. Even in some, they are boosted. It's really this way because this is BA.5 and protection from vaccination drop as low as 30% with your primary vaccine. Even if you're boosted, protection drops to 60%. But at this point in time with BA.5, your protection against severe infection is maintained at between 65 to 70%. And that's still a good rate. No? And I think it's critical, Robbie, to monitor the healthcare utilization because as cases goes up, a lot of these people will really be going to the hospital, and we would expect the vulnerable population. So what is really needed here, okay? If you want to look at this as something like endemic, we need to have measures that are accessible to people in terms of treatment, in terms of diagnostics, in terms of care, because as long as they are not into the hospital 4 to 5 days with the symptoms, they can go back to work, and I think the population will be fine.
All right, that's another tricky question. We were just talking about the state of the economy. In a way, COVID helped us get to this state of the economy, Dr. Leachon and Solante. Are we supposed to, what do we do right now? With the healthcare utilization rate going up slowly, the surge has also been going on slowly, but surely it is a sort of a quote-unquote prolonged surge. What do we do in terms of balancing the economy and our, healthcare capabilities?
I think we have to remember the marching order of the president, no lockdowns. And we, the Advisory Council on Experts, we are right now one group we are in agreement with this. But there are, personal responsibilities and responsibilities that cannot be done by the ordinary Filipino citizen. What I'm saying by personal responsibilities that you can actually test and, of course, trace and isolate and then treat this as an ordinary flu and then just go back to the office and all. But remember, even if you are not hospitalized, then family activities as well as workplace, disrupted ka pa rin. Disruptive. And magka nagkasakit ka, yung productivity and quality of life mo, ganun din. Then eventually, if a lot of people are sick outside of the hospital, ang mangyayari dyan, you have a sick economic workforce. Wag mo nang ibilang dito yung long COVID syndrome. So, ang dapat gawin dito sa next 100 days, I think dapat mabakunahan ka agad, mabooster ka agad, para sa ganon, maging resilient ang Filipino population. But I see right now, after the son of the President last July 25, wala akong makitang clear roadmap as well as, clear roadmap as well as the detailed vaccination program. Akala ko nga magkakaroon ng one vaccination week so that we can ramp up on the booster because it is a rate limiting step to the face-to-face classes in November as well as the December business activities. And apparently, hindi natin na-achieve to. So this is something that the President should do right now. Call the cabinet a meeting, all hands on deck, partner with the business sector, and then do the boosting right away, as mentioned by Dr. Solante. Ayun ang dapat natin gawin. Kasi parang bahala na kung kailan tayo matapos na sa boosting So yun ang tingin ko dito.
Hey, Dr. Leachon, how will that go? Itong what you were hoping to hear, not just a strategy, but even specifically you were saying maybe we could have called for a 1 week special push, special program, week-long for everybody to but on the ground, what will that look like?
Well, ang tingin ko is, in fairness to the previous administration, very successful in December vaccination program ni Secretary Carlito Galvez. If you remember nun, Jean, around 15 million na nabakunahan na nun . And that hybrid immunity, yung vaccine plus yung Omicron last January, yun na nag-contribute kaya mababa ang cases natin for 6 months until nag-wane yung immunity. We should not reinvent the wheel, gayahin lang yun. And then all hands on deck para sa ganon matapos itong problema natin. Ang problema lang natin kasi na nakita ko, nag-expire yung vaccine sa dapat nating gamitin. So we should have an inventory of the expiring, the expired, and the active one because ang problema nito access Kahit sabihin mo sa mga LGU na magbakuna, wala ka naman palang ibabakuna. So hindi clear sa lahat ng tao on the inventory of the vaccines.
I mean, Dr. Solante, nabanggit ni Dr. Leachon, an inventory para malaman natin yung access din, no? But apart from access, especially because we mentioned also the expiration of a batch of vaccines, other than access, is there a supply issue at this point?
Well, I'm not so sure if there is a supply issue with most of the vaccines are expiring. That can be another issue later on that we will be facing. But again, I totally agree with Tony that the access then during the time was an issue also. And in fact, I see some patients telling us that they were in the center, they were looking for this vaccine, but it's not available because the only available for the booster is this and this, and it's not available. So something like that. So I think on the part of the government, when we implemented the first booster and the second booster, we were recommending all vaccines can be used as booster, okay? Not only the mRNA, but what happened is that only the mRNA vaccines were being used, and I think that's why a lot of Astra vaccines expired. No? So sayang din. Okay. So these are some of the important issues on the ground. Bakit may na-expire at hindi nabakunahan lahat? So more on the supply issue and implementation problem.
Okay, maraming salamat po, Dr. Tony Leachon, Dr. Rontgene Solante.